I'm not that worried about being replaced by AI because the magic in our industry happens when you put experts from many different fields in the same room. In fact, I like to do it in the same room around brown paper with sticky notes, drawing pins and string and stuff like that. And that's when the magic happens, is when people communicate with each other. There are all these constraints and, what you can do to address a manufacturing issue could affect, how you can do your clinical trial, or there are many interdependencies. And it's only when you actually visualize it together and really talk about it and come up with brilliant solutions that things really work.
Welcome back, everyone, to the Collators. Now, on the pod, we usually speak to intelligence types. We sometimes speak to academics. I'm sure you've heard me or Howard occasionally mention business intelligence. We've had the odd light touch with the private sector, but not much. So we thought it was about time to actually get somebody with real private sector experience. And we're very lucky to have a lady called Sarah Holland join us on the pod. So, Sarah, I'm going to let you introduce yourself. So, Sarah, welcome to the pod.
Very honoured to be here. My name's Sarah Holland. I'm the Chief Business Officer of a biotech in Switzerland called CDR Life. And we make things called T-cell engagers, which maybe some of your listeners know what that is. But basically, as a Chief Business Officer, I do deals. So I do partnering deals. And I also have another role as president of the Swiss Healthcare Licensing Group, which is an industry body for deal makers in Switzerland. We have our big annual conference coming up starting on Sunday. And I sit on various boards. I'm also on the advisory board of Manchester Business School, for example.
Wow. So in terms of how now are very familiar with other types of intelligence, we still sometimes hear the term business intelligence thrown around in our public sector side of life. Is it really a thing? Is it something you give much thought to, or something, or you call it something else?
I think that term is used. We also talk about competitive intelligence. We talk about disease insights, patient insights. So everything we do is all around data. The whole business is built on intellectual property, which is based on data. So information is really, really important to us. Building a value proposition, coming up with a differentiated medicine that will actually be attractive to payers and meaningful for patients and doctors means we have to understand what we're competing with and what we have to beat and how we have to, what are the unmet needs we have to address. So intelligence is really crucial to what we do. And there are many different types and many different sources that we use.
Could you give us an example of some of those sources? I'm curious about how that information is maybe gathered, and also curious about how it's analysed, how you kind of work, how do you get the insight from the raw material?
Yeah, so there are many sources. There are databases. Examples would be things like Sightline or BCIQ. So there are professional organisations that compile, for example, all of the drugs that are being created all over the world into a database. And then you can interrogate that and say, okay, tell me all the molecules that are addressing, cardiovascular disease or this particular mode of action. So there are databases. There are many newsletters, newswires. So you get a lot of stuff in your inbox about what's happening, what the latest deals, what's the latest clinical trial data, what's the success of different launches. You've got publications. So people write scientific papers, medical papers. So you have all of those. You have congresses where you can visit all the poster boards and see what's happening. You have advisory boards, key opinion leader interviews, regulatory insights, how is regulation changing? That's really important. So there are many different sources. And how is it analyzed? That's probably pretty company specific, but that's the crucial thing, I think. How do you turn all this kind of information into actionable insight is the crucial thing to challenge, because there's too much of it. So how do you distill it into something that's actionable?
Sarah, what you say is really interesting. It mirrors what we do and what most information-driven organisations do. They collect data from whatever source they can find that they feel is valuable to their business goal, and then they analyse it to produce a product, in your case, information that you can action for one of your business goals, maybe a new venture. But when you're talking about medication, that's a really important societal benefactor or risk if it goes wrong. So you must be picking up not just on, as you say, the industry information about drugs in general, therefore your competitors, but also about their efficacy, their chemical structures, scientific research into them, so not just business-driven research, which is hopefully peer-reviewed and therefore has a level of credibility, maybe. But the other thing is, you'll be talking to customers, the clients of your products, and maybe the clients of your business partnerships and business ventures. But you're also going to be talking to governments, both regional, national, and I suspect transnational. So for all of that, your communication skill is the one standard, the one asset that would take you across all of those, your ability to receive communication effectively in the forms of the information, but then after digesting it and coming up with a business plan to then persuade and engage with other stakeholders to come to a successful business conclusion. How important is the communication skill to effective decision-making or even to effective insight, do you think?
Well, I do think communication is fundamental. I mean, I'm not that worried about being replaced by AI because the magic in our industry happens when you put experts from many different fields in the same room. In fact, I like to do it in the same room around brown paper with sticky notes, drawing pins and string and stuff like that. And that's when the magic happens, is when people communicate with each other. And there are all these constraints and, what you can do to address a manufacturing issue could affect how you can do your clinical trial, or there are many interdependencies. And it's only when you actually visualize it together and really talk about it and come up with brilliant solutions that things really work. And there are many ways to mess up and to get it wrong and to fail to deliver a good outcome. And there's generally quite a narrow path of creativity and, solution finding that gets you to success. So I think human ingenuity and communication is fundamental to what we do. I do think as an industry, we're brilliant at influencing, for example, doctors, to change their behavior and to adopt radically new ways of doing things. I think we're absolutely terrible at managing how we're perceived by the public and by governments and payers. And I think it's shocking how little effort the industry puts into that and how it fails to communicate itself. This is an industry that effectively saved mankind from a pandemic and is somehow vilified for it. So I think in some ways communication is fundamental to our success and our results. And in other ways, it's a huge failure as an industry.
Here we are with our backgrounds in law enforcement, and we are appointed by society to enforce and apply society's rules, not our own rules. And yet, quite often, the operational arms of our organisations are viewed as the bad guys. Nobody likes somebody telling them what to do. And you're right. I always think I get this same negative perception of drugs companies making money. And you have to remember, I make no case for that, other than the business case of if they didn't make money, they couldn't develop drugs. And what that links me to is the philosophy that in this case, good health, like good societal health, an orderly society where people are happy and they work together effectively, are privileges. They're not rights. Only human beings could be so arrogant to say it's your right to be healthy. It's your right to live in a society where everything is fair and equal and we all walk hand in hand into the sunset. Imagine a world without drugs, or imagine a world without any kind of societal control, anarchy in its most absolute sense of the term. It would be ridiculous. We'd all be dead in a couple of days. So I think they missed that argument. But the one that stands out for me, and this is an issue that we have in law enforcement for Intel, is how do we as an organisation define success and failure? And I noted that you mentioned success and failure. The easy one for us is to identify failure, because when law enforcement makes a mistake, something usually severe happens. Somebody gets hurt. It's kind of like the military or the medical profession. People die. And that is a very good, shall we say, flag to drive change, to avoid failure in the future. One of the problems that we have in law enforcement is how do we define success? Because if your role in success is to prevent crime, how do you know that crime would have happened? Is it just a natural feature, or is it because of what we did? And particularly in the intel world, it's a nightmare for us because we're never on the front end of arresting people or going to court and standing in front of the cameras. We are the invisible shadows that pull the strings behind the scenes for other people to get the glory. I'm not complaining about that. I love it. But the reality is, the question is, how does our part of the team game be assessed fairly? Because we've always thought that bad intelligence with bad action leads to a bad result. But good intelligence with bad action can also lead to a bad result. So I can imagine in your scenario, a good drug or a good new product, but with bad, shall we say, market placement, giving it to the wrong patients for the wrong reasons, being really simplistic, would result in that drug being a failure or being perceived negatively. How does your industry recognise success other than we're making money and doing better than the next guy versus failure, i.e., something's gone wrong with one of the drugs?
What's different for us is that we have randomized placebo-controlled trials, so we do the toughest possible test of our product. It's really tough because, there are so many confounding factors that can mess up a clinical trial. So you have to have a really impressive effect for it to overcome all of that confounding and actually deliver a result. So in some ways, it's incredibly objective. And when we have and it's very black and white, and you can invest, these trials can cost hundreds of millions and they can fail. So ideally, you want to detect things going wrong early. You want early kills because you don't want to have a late stage failure. You want to kill things early if they're not going to succeed, which means you have to be really, really thoughtful about how you design every test right from the very beginning when it's a molecule in a test tube all the way through preclinical and testing before you get to human, and then what you do in humans. All of this needs to be really thought through so that you don't make a mistake. But it's very dangerous. It's very easy to get groupthink and get all excited and say, well, if only we designed it a bit differently, it would have succeeded. Therefore, we should keep going, the sunk cost fallacy. But yes, even if you get to the market, you can have drugs that are effective but are not seen as successes. There have been cases recently with Alzheimer's antibodies where, reps were being banned from hospitals in the US, really quite dramatic actions. You've got the terrifically awful opioid scandal where these were effective drugs for pain, but they were also addictive, and doctors were being rewarded for giving more drug, and that was appalling. And people were dying, so there's certainly been scandals and worse than market failure, real kind of moral failure. But on the flip side, most drugs are extremely rigorously tested, subjected to strong regulatory scrutiny. Even how you communicate about them and promote them is heavily regulated. So, most of what we do is very much above board and very beneficial.
That's really interesting. When you talk about the testing regime and the laboratory, if you will, scientific process, I recognise all of that and respect it very much. That's not to say it will always be perfect. It won't. Like any system, there will be failures. But if you can be as alert as possible at every stage and try and manage and minimise those issues as early as possible in the process, that's the best you can do sometimes. But the one that stood out in what you were saying, and it's what we see globally when we see the pushback against the pharmaceutical industry, is not a failure of science. It's more this failure of morals when the clarity of what the purpose is here, what's most important, gets overtaken by the free pen in the sales side of things. But I've seen it in law enforcement when global law enforcement started to take up IT. When computers came in, law enforcement were not used to dealing with the private sector. And companies were used to say, they could say anything to senior officers who are masters of their own profession, but complete novices in the private sector world. They weren't ever used to dealing with that. They were government agencies and ex-military, by and large, in terms of a management model. And the industries used to laugh at us and say, well, you can be bought for a free meal. You're the cheapest, easiest market. We take 3 chief constables and their team out for one meal at a Beefeater restaurant of the day, and we've got the contract worth millions, and they're giving us the data and everything. And law enforcement were very naive of that arena. They're not so much now, but they will always be naive because they are clients. They are not partners in the development of these tools any more than patients, and even GPs are largely, shall we say, clients of the central expertise of the pharmaceutical industry. So with all the effort that you put into, as an industry, the care of the science, and the risk management of the science and it's the evolution of the product. Has the industry done the same to try and put care into its ethical models or its business models to try and control, the moral aspect, not whether the drug is good or bad or whether there might be side effects. That's a scientific fact, whether it's known or not at the time, but whether or not the pressure, even at a local level for a small group of bad apples, shall we say, to over-incentivize a product or disincentivize it for some other reason, be it money or rank, respect.
It's a very, very regulated industry. So people are not allowed to even go and see a doctor until they've been very heavily trained and certified. And in fact, the amount spent on marketing has diminished a lot, and it's much more on medical education now because there's so little you're actually allowed to do on the marketing front. And I would say the powerful customer is no longer the doctor. So the doctor is not really such an important decision maker anymore because they are very constrained by what they're allowed to do. And it's the payers, it's the people that pay for drugs who are controlling what they are and aren't allowed to do and what they're allowed to prescribe. And payers have been very effective at replacing most frontline treatments with generics, which are very cheap, older drugs and, very effective. But after, 10, 15 years in the market, they become generic and become very cheap. So payers have been incredibly effective at controlling drug use and getting it replaced by generics. And so the industry's ability, and the industry really has to convince payers that it's worth spending the money on something and has to get the payers to put it in their algorithms and their protocols and their, I can't remember the right word, but the treatment paradigm. And then the doctors are allowed to prescribe it. And yes, you can influence them to some extent between, similar drugs. There's more money is now invested in education. I would say the only exception is the US, where you have this direct to consumer advertising, which is not allowed in most other countries. And it is quite shocking when you go to the US and you see all these drug adverts on television. That's quite an eye-opener to us Brits, for example.
But it is for us in law enforcement.
Yeah.
Currently, Mark and I've got loads of US law enforcement friends and have had for the last half a century, or 40 years anyway. And we look at what's going on versus our ethics and values and standards, shall we say, and experience. And you think, my God, it's not just a feeling of shame, it's shock, because it's not just a little bit beyond a boundary, shall we say, pushing a boundary. It jumped over the boundary months ago and they're now running on the other side of the track completely. And you're thinking, this isn't us, this isn't what we do as a global profession.
So I wonder if I could just take you back to something that you said when I was asking you to describe the essentially how this is a challenge we have with all our guests, to be honest, and me and Howard have it too. We, for obvious reasons, don't give away tradecraft. We don't give away anything that would give anybody an advantage in a criminal context. I'm not going to ask you to give away anything that's commercially sensitive, but I'm wondering, can I ask you, in terms of the challenges that you mentioned about overwhelming information, there's so much information coming in from so many different types of sources. I'm just wondering, could you tell me a little bit more about how you personally manage that problem, if you can, without being too sensitive? And if possible, is it possible to tell us a little bit about how your company, for example, is there anything that wouldn't be sensitive that you feel comfortable sharing about how you manage the deluge?
Yeah, it's a really good question. So partly, I think intelligence becomes useful when you already articulate your question. If you have a very clear set of questions, then it becomes purposeful how you obtain information and use it. So I think an important thing is knowing what are your critical questions and then seeking out information to address those. I mean, for example, it gets very technical, but we have drugs that have a structure where one part of the drug grabs hold of a T cell and the other part grabs hold of a tumor or an aberrant immunological cell, and basically we kill it. And there's lots of questions that come up with this, like, what's the optimal dose, what's the optimal treatment frequency, what sort of tumor will it work in, what sort of tumor will it not work in, is there a way to improve this, and if you articulate your questions very clearly, you can then interrogate all those different information sources and find those little nuggets. And actually one of the most useful bits of information I actually saw, because I believe in following people on, I think it's called X now, but the old Twitter, and they kind of curate information for you because they're scientists and medics that are interested in the field and they put out what they think is cool. And actually you get a lovely distilled version of science. And one of them put out this really interesting, very high quality bit of work comparing different schedules. So giving this drug weekly, giving it 2 weekly, 4 weekly, 6 weekly. And interestingly, 6 weekly was actually the most effective, which wasn't what my company would have expected. And I still haven't got it through everyone's brains that this is a really important bit of information that could stand us on our head in terms of how we think about things. But, I love counterintuitive information and really taking that on board and saying, okay, let's question some of our most fundamental assumptions about what we need to do here. And so that, I think, if you know what your questions are, if you allow yourself a bit of serendipity in how you see the answers, sometimes just being open to Twitter or Newswires or whatever and spotting that thing. I think that's how you get the best out of it. And we have a strategy day next Wednesday, and I've been compiling, what I think are the key crucial bits of information that kind of you stitch it together and you start to see a picture emerge of how we should be developing our drugs. And I think we need to have that conversation. What does this all mean for us? So that's how I think intelligence should be turned into insight and used.
I think that's fascinating. I think essentially what you've just described is something we'd call the intelligence cycle. Essentially, at the start of the process, you would set your questions, your collection plan, and that would kick off a series of events. But you're absolutely right, questions rule the day, and your questions determine the answer. But I also think the other thing that you told us there was actually that there's something to be said for logic there, something for the building that kind of mental model of not just individual questions, but how those questions relate to each other and some sort of building some sort of mental picture around that.
That's really refreshing, Sarah, because it is what we do. Mm-hmm. We, and I say we, I'm talking here with my intelligence and analysis hat on, not senior officer, decision maker hat as an investigator or senior police officer. Because we are trying to find the nuggets and the pieces of important information. The first thing is, it's very easy for any organisation, and law enforcement is one of the worst, to stick to the conventional trusted sources of information. Crime data. Crime data is lovely, except when people aren't reporting crime. You can't analyse data that people are not putting into the data pot that you're looking in. So this concept of people change habits, data changes its habits, it evolves constantly over time. Like you say, Twitter becomes X. What did we do before Twitter? What did we do before Google? What did we do before computers? Those same information systems are still running. They may have less relevance in terms of the amount of times they're interacted with by the society and the environment, but they're still there and they're still important. We go nuts when you say to an analyst, what do you know about this? And they say, oh, nothing, but I'll go Google it. And, I just want to shoot myself through the head because it's like, well, I could train a monkey to Google it. Google will Google it for me. It has an AI assistant. And if you accept the structure of AI as it is so far, as I agree with you, and I'm sure Mark does, it doesn't do the thinking for you. It does the drudgery for you of looking through the data pot. It can look at the large language model and summarizing and assimilating that data in a certain structured way that's based on how everybody else used to structure it, because that's the safe way, even when it's trying to be radical. I'm not saying it's not really good, but it's the ego to Dr. Frankenstein. It's not the Dr. Frankenstein with the zany mad ideas. So the first thing is, as the systems are evolving, if you don't evolve your data collection and keep it as wide and open, as radical as possible, at least to sense the data's there. You might not put boatloads of resources in it, but you got to have a little listen outpost in that data set. You're going to miss something, and it might be a business advantage. Second thing is the different types of way that you analyse the information. What I really like about what you said is kind of how we would describe what's the value that we add when we're asked that by our senior managers. But we would say, well, we'll warn you when you're asking the wrong questions or when you're looking in the wrong places, the wrong data sets for the answers to the questions. Because either the data or the question or both are wrong for a particular purpose if you stated what a purpose is. And unfortunately what that does is often show senior decision makers that not only are their perceptions are wrong, but their preconceived ideas of what the issue is and what success might be or failure can also be wrong. We spend our time educating not just our information sources, people further behind us on the information trail, but the people ahead of us in terms of gently speaking truth to power, that actually there's a different perspective here that might be of more value than the one that they've come up with in the comfort of their office. And I'm being really controversial here just to wind people up, but you know what I mean? I'm not saying these aren't intelligent people, but there's no point in having a business structure where other people collect information and come up with ideas and report them to you and then doing it yourself anyway. It's kind of self-defeating and a self-evident flaw in the business structure. How do you find that? You know, obviously, if you've got this logic and focus and creativity in the way that you and your team collect information and find that nugget, which is the super sexy thing that is what that's the big dopamine hit for all of us. We love it as well in law enforcement. How do you then communicate that in a respectful, supportive, professional, but challenging, inevitably, way to people who are not used to being challenged, people in positions of power? And it might not be rank, it might just be they are the key node in this network.
Yeah, I mean, I think it's a really interesting point. You know, how do you actually have impact? 'Cause it's all very well having insight and knowing the right answer, you know, but how do you get that adopted widely? And I think that's a huge skill in itself, how you manage stakeholders, how you manage upwards. I think the great advantage of being British is you can use a lot of humour. And I notice I've often worked for people that are kind of a bullying personality. You know, I look at Trump and I've seen personalities like that in the private sector a lot.
We have
and I've always stood up to them, and they do respect that. After about 3 months of storming, they respect you when you walk on water. But you can use humour to sort of question people's fundamental assumptions in a way that's acceptable. So that's one thing that's worked. And I think being quite strongly data-driven can also work. It depends on the person. You have to understand whether they're more influenced by data and logic, or whether they're more influenced by feeling like it was their idea in the first place, or whether they listen to certain people. And, you know, you have to build your credibility and get your allies, because just being a lone voice also isn't so powerful as having allies. So yes, you can. I mean, I used to run the M&A team at Roche, and I got Roche into rare disease. I got Roche back into antibacterials. And it was many different elements. You know, I was lucky enough to have in my team the lady who digested information and sent it out in email form at that time to senior management. And that was an incredibly powerful thing, because you could basically influence what they were thinking about day to day. And so you could sort of be seeding this psychological information in the background at the same time as putting a business case forward in the foreground, and, you know, kind of bring it all together into a result that ended up with us acquiring a company, you know. But yes, I think not only do you need to be obtaining good information and analysing it and coming out with a logical, rational way forward, but you also need to have the skill to move the organisation in the right direction. And that's another whole set of skills, much more human.
I love that, because for several guests we've had, and Mark and I have done it, you have to apply as much skill and creativity in that politics with a small p engagement with decision makers and key people in the network that you do to the intelligence and the information, the data that you're driving. Because if you don't, you're creating conflict without change. And conflict without change is conflict. You know, it just creates a bad atmosphere. But we've had a couple of guests who've used humour or found ways of indirectly communicating, so that it's not a challenge at the formal meeting where you've got the typical power struggles going on that are nothing to do with what you're talking about or what you might be presenting. But take it away and use a back door. And one of the things, I certainly always did that as an intel operative, not just with senior managers, but with criminals. You would attack them, not, shall we say, at the front wall of their castle where it's heavily defended, in their crime network, but you'd find something out about their personal life, their wife, their mistress, where they lived, and create some inconvenience that would influence their behaviour without them ever realising it was law enforcement. You know, the bins didn't get emptied, or the electricity got turned off, or the organised crime lord's girlfriend couldn't get a haircut, or the manicure. And you're thinking, what the hell's that got to do with law enforcement? Well, if I am the David and my target is a Goliath. It was a cost-effective way of creating change without them realizing it was us that did it. If that makes sense.
I don't think I've ever had anyone done it, Tristan. The other thing that occurs to me actually is I've been in situations where we have a fundamental disagreement about, for example, how to price a drug. And the Italians might be saying this is going to be possible, and I'd be saying this is going to be possible. And I found a good solution there is to say, okay, well, let's do some market research that we design together. We agree on the questions, we agree on the methodology, and we agree that when it's been done, we'll abide by the findings. And if you're right and, you've done the right analysis and you have the right strategy, then the market research will support your position. And because, your Italian affiliate friends or whoever help design it and feel ownership of it, they're also find it much more palatable to live by the findings because you did that together. And often discovering things together in an objective way that you've agreed on is quite a good way of overcoming difference of opinion. Yeah. That works quite well.
Or even you throw the seed in and it goes round the table, and then the CEO at the other side of the table says, I've had a great idea. And you're thinking, yeah, but at the end of the day, does it? I know it's stealing it, but it's not, because at the end of the day, if the idea gets implemented, and I've had that situation where senior officers have come back to me afterwards and said, look, I know that was your idea, but it had to be me. But if you have any more, don't bring them to the meeting, come and see me privately. And if and we can have a one-to-one without the, shall we say, a rank or role differential. And Mark and I are always in this power vacuum compared to many of our customers. We punch way above our weight, but sometimes they're busy punching back because of our junior position.
One of the reasons why I invited Sarah on was that I have worked with a few colleagues in the private sector, as you have, Howard. And one thing we often say in intelligence analysis in the public sector is, why doesn't the business world take on more of our practices? Why isn't intelligence analysis, why isn't intelligence as much of a predominant thing? Most businesses will have, for instance, maybe, a marketing department or certain core departments. They're almost always there. Whereas, why don't most large businesses have an intelligence analysis department? Something like that? And I think what it boils down to is, and I want to get Sarah's take on it first, if that's okay, is I think that in the public sector, in a military and law enforcement context, if you treat the organization, and forgive the analogy, but it's a bit like a ship with a crow's nest, what we have is we have delegated departments and teams for sitting in the crow's nest, making a sense of what's going on, getting all that information and then passing it on to the captain. And the captain is usually somebody who is devolved locally. So it might be, in your case, Howard, you might be dealing with murders, but it might be another officer who's dealing with volume crime. But in private sector, it's not like that. In private sector, essentially, there isn't enough money, or money's not allocated usually to entire analytical teams for situational awareness. The crow's nest, if you like, is essentially the management tier at various different levels. And they're the spine of the organization. And it's almost like that the management tier is they're the sensory being, if you like. They're in the crow's nest and they're feeding information to the captain. So I guess what I'm trying to ask, Sarah, is have I got this right? Because I have this notion that the reason why business doesn't value putting dedicated resource into intelligence as a discrete and separate function, why it allocates it to its existing staff already at different grades, is because, is it too expensive? Is it too high risk? Would it be too bureaucratic to create a separate department or function for that? Because I think one of the reasons, to answer my own question, when us in the public sector, military and law enforcement say, why don't big business have their own intelligence analysts or their own intelligence analysis departments? My guess is it's deemed to be too expensive for a skill set that they think that their management class already have, as in situational awareness, information gathering, things like that. Does that make sense?
I think in the past, Big Pharma did have intelligence. Maybe they called it market research or something else, analytics or something. But I think it did exist and it does still exist. I think people like to believe that AI can somehow magically replace it. That may be one thing. But I think the other thing is that although there's always wonderful sources of data, in fact, the most important information is not yet captured in any of these sources. So we haven't talked about, I think you call it humint, but gossip and what you hear, particularly, bankers are the most appalling gossips, venture capitalists. These people are aware of things that are not yet captured in data, but, they know what's happening. And so, intelligence department can't necessarily capture what you can capture by gossiping with a banker or gossiping with a venture capitalist or even just with your friends. There's so much happening in China in our industry, and it's not necessarily well captured in all the conventional sources. But knowing a Chinese friend who spends their time in China, that's worth a whole intelligence department. So I think, yes, you could be right that intelligence was never adequately respected and valued. There are exceptions. There's a company called Roivant, which has had tremendous success in our industry. And I think they do value intelligence and do invest in it and are incredibly on top of it. And it is paying off for them. So I think there are companies who recognize it. But I think, maybe nowadays people are saying we don't need those big departments because we've got ChatGPT or something like that, But also, I think however wonderful your intelligence department is, they won't have the connections to gossip with bankers and gossip with VCs in the same way as your CEO does. So sometimes those personal interactions are only possible at the most senior level, and they're incredibly insightful. So, you can only do so much in an intelligence department, and you're going to also need those leadership cadre relationships to fully build a picture and to know what's the most up-to-date information that isn't yet captured in a formal way.
You're right about that, and I'm sure Mark would agree. But for me, I sort of disagree, and not directly. But one of the roles of a good intelligence department is to actually drive the intelligence gathering operation. And even if that includes the CEO having a glass of sherry, that information in that situation, that CEO is gathering the information, but is still limited by their own insight and knowledge. What the intelligence department should have been doing is directing all the senior managers to explore what their human gathering capabilities and opportunities are, then driving that gathering, but also receiving the information back, putting it into the pot to make all the connections far more quickly and effectively than each senior manager can, and then feeding it back out. We would spend more time driving intelligence gathering than we would about analysing the data, because you can't analyse incomplete data sets. You're always going to end up with incomplete answers, like you say. Just if everybody can look at AI. It's the ultimate competitive industry, but you're all competing for the same insight into the same pot of knowledge. The real innovator, the one that's going to make the next stage step above and beyond that, is the one that's going beyond the data pots that everybody else is, and B, analysing that data together with the AI data or whatever sources you use conventionally to come up with new and radical ideas. Doesn't mean they'll always be successful, but that's the idea of inductive logic, that you're actually creating something new rather than, you're all competing against making the same thing as everybody else. If a jigsaw's 100 pieces large and you're all trying to come up with the best and most effective way to build the jigsaw, the answer is get the 100 pieces and put them together quick. But if you've only got access to 90 of the pieces, or you don't even know what the big picture is, you're destined to fail. We had this in law enforcement, where people who ran human intelligence sources thought they were it. So they owned the data. And I've seen the same with senior managers in private sector. In all sectors, I've seen it in academia. Well, I have information that you don't. Well, that's no good for the organisation if it's sat in your head. You don't have what the rest of us have. Put it in the pot. Let somebody... You're a busy person. You're a CEO. You've got 1,000,001 other things. That chance conversation, throw it at us, and we'll machine it faster than you can and tell you whether it's worth anything or not.
I love your vision. I love your vision of having these. In an ideal world, you'd have some key, crucial bits of information. Everybody in the organisation would be aligned in trying to obtain it and feed it back. I sort of struggle to see senior management taking the time to feed things back, but I love the idea.
You're right, but in law enforcement, we kind of learned the lesson. The only saving grace was these people who controlled these sources were not senior managers. Mm-hmm. They were fairly very skilled, but fairly low ranking from a management point of view. And their information was siloed away from everybody else. Mark and I have spent our careers trying to break through silos within our organisations. It drives you nuts. There are, don't get me wrong, there are correct and proper business reasons for that, but sometimes they can get in the way of doing a really good job and make the work you're doing irrelevant. I'm always a glass half empty. I see the potential and the opportunity rather than putting up with things. And law enforcement kind of learnt that lesson. I mean, senior managers these days in law enforcement are not the leaders that we had in the past. It's a different beast. even to when Mark and I were involved, and in my case, that was just over a decade ago, although I am still kind of involved. But in law enforcement, it's a bureaucracy. It's the slow-moving Titanic, like all the public sector is. In business, you need to be the destroyers. You need to be nipping about, not the I know structure-wise and logistics, you probably are the Titanics, but you need to be in your information systems, the little destroyers nipping about and being really, the Ukraine drone manufacturing structure, if you can.
I think what you're both saying is very important. I think, but what you're demonstrating, I think, is just the massive cultural difference between the private sector and whether it be UK, whether it be law enforcement, whether it be military. And this is what I was trying to touch on. But a shout out to the Intelligence Tradecraft podcast and a friend of our pod, Jeremy Levin, who was recently talking to the host, basically saying that, and because he came from a US military background, he was used to kind of teams and teams of analysts. Teams would even potentially check other teams of analysts' work. And Freddie, the host of the show, basically said, well, look, in the private sector, that's not going to fly. Sometimes you would have entire intelligence functions dedicated to one individual. It might be the marketing guy. It might be the CEO. You just wouldn't have that. And I think that's the culture shock is, and Howard's analogy of like having a large oil tanker versus a small speedboat, I think is right, because I think in the commercial context, the commercial entity is stripped down for efficiency, and I understand that's a good thing and it's a very necessary thing. I do think, however, though, that I think our side of the fence in intelligence analysis, public sector, we're great at answering questions because that's where most of the investment has been. There's been a lot of investment in creating the factory that makes product, and then the more investment in generating analysis of that product. We have a lot to offer in that space, but I totally accept that we've had way more investment in that space. What I think our side can learn from the private sector is, and I think you touched it right at the start, Sarah, is setting of questions. Because what I've observed in private sector organizations is, be it C-suite and above, they run the show, they set the questions, and those questions get answered. They may not be answered in, shall we say, the best possible way in theory that's theoretically possible, but in terms of the staff that you've got, they'll get an answer. So I think there's a structure there. I think there's something maybe we could lean into about saying, okay, well, if the private sector is good at setting the questions and answering them with limited resources, but the public sector is good at answering questions with, shall I say, some more resources, I think there's some interplay there. I think there's something to look at because, as you said before, I'm fascinated by your point about the CEO, having a relationship with somebody else and saying, and then hearing a little bit of intel about something. Absolutely. And again, we're back to investment in the public sector. We would have intelligence officers paid to go off and try and generate those leads. But obviously, that's an incredibly expensive resource. So and it's a difficult one to quantify. I think it's as Howard alluded to at the start, you've got to try and prove your value. And I guess having a team of analysts may struggle. But let me come back to something you said, Sarah. So you seem quite confident when it comes to AI. You seem unfazed. Which I think is a good thing, and I agree with you. But can I ask why you've got that opinion of AI? Maybe.
Well, my previous job was chief business officer of an AI-enabled biotech, and I think I learned a lot about what AI can and can't do in our industry. And basically, a lot of the information that's really valuable is behind firewalls. So if your AI isn't able to go behind the firewalls of the scientific journals, for example, then it's got limited value. Also, what's most powerful for our industry is having proprietary data sets to train your AI. Maybe I'm thinking more machine learning, but if you really want to create value with AI in our industry, I think you need to have some proprietary data that you alone have access to and that you can learn from. And then that can give you insights that enable you to crack a disease or something. So I kind of learned that AI based just on publicly available information will probably be very quickly, replaced by ChatGPT and really not, yes, it's great and you can distill stuff fast, but it's not a great step forward. What we really need is deep insights that we haven't got today, and how these diseases really fundamentally work biologically and how you can really tackle them. And that you only get by generating quite rich data sets yourself from the private and then analyzing them. I mean, that's not helpful to an intelligence community because it's all hidden.
No, it is. I think you're right. What's fascinating to hear that, and it's reassuring to hear that, is you are echoing a view that essentially both me and Howard have, which is, AI is massively overvalued. It does have a lot of potential, but I think the view that we've come to on this pod is essentially where we think AI is going to be in the next few years. Next 10, 15 is a different issue, but the next few years, essentially AI is Wikipedia 2.0. In that if you've got an entire business model saying we'll only use Wikipedia, if you did that 10, 15 years ago, you're going to struggle. You're only going to get the best of what I says to that. But in terms of if it's a starting point, if it's a tool you could integrate into your existing processes that have been stress tested, relied on, as long as it's not the start, middle, and end of the story, which I think when you said at the start of the pod, some businesses might be leaning into saying, well, we can get ChatGPT to do everything. And that might be true for call centers. It may be true for certain elements of analysis, right? So performance stats and, putting bar charts together and doing very rudimentary stuff. But I think for generating the questions that you mentioned earlier and generating that logic, I'm not sure AI is there yet, because as you said, if it's not in the training data, there's firewalls and barriers there. But I think that the risk that we see in the public sector is that senior managers and senior budget holders, they see, well, I have department X that does function Y. I can do it with this large language model and I can do it very cheaply. And essentially, well, yes, you could, but you're probably getting the crudest, most simplest version of what you could do. And a lot of value is lost. Mm-hmm. Does that kind of resonate with you? Does that kind of make sense? Or do you have a different view?
Yeah, I mean, just as a general comment, I think, looking at big organizations or how you spend your time, 90% of people, 90% of your time is kind of painting by numbers. And it's only about 10% of people and 10% of the time that people actually engage their brains. And that's and you can tell when something's actually had engaged brain work, you can see the difference and it's so much more meaningful. And, many organizations are full of people that are sort of, just sort of going through the motions, but not really engaging their brains. And what I love about things like Ukrainian drones is everybody's engaging their brain all the time and you can see the difference, So not quite sure where I'm taking this, but I would say to people, my advice would be more about make sure you're doing real stuff that really delivers something. Don't do roles that are kind of, slide monkey for senior management. Do something that is really having a meaningful impact. And you can say, as a result of what I did, this drug is now on the market, or this whatever. This change has happened because I personally had a role to play in it. So that's one thing I'd say. And just make sure you're engaging brain, so however you're using information, make sure you're actually applying your brain to it. And, when you've really made an effort, don't you? You can tell that you've really thought about something versus you just produce something like ChatGPT does. I don't know.
Absolutely.
I feel like
that's why we use the Wikipedia kind of analogy is that I think when I'm a donator to Wikipedia, I'm a massive fan of Wikipedia, and Wikipedia is a great starting point for facts and information, but it is not all information and facts. It'll point you to the books, it'll point you to the resource, it'll point you to I think what we're seeing with large language models is essentially we now have a common library of logic where you can ask a question and you can get a answer, may even be a plausible answer. Is it the answer an expert would give you? Is it an answer that would be checked properly and assessed properly? In some fields, yes, perhaps, but in other fields, I expect not. Sorry, Howard, we want to come in there.
Couple of things that Sarah said that float my boat, if you will. On the AI, I agree with you. This idea of having market-specific or subject-specific data sets that we can allow it to look at will massively increase its ability to understand and speak our language, whatever that is. Certainly law enforcement is starting to do that now. That really scares me, and I could imagine a similar situation in your marketplace when you're dealing with patient data. Because, yes, all right, it's there to summarize, but one of the things that made me smile recently, I mentioned it to Mark, it was just a radio program, somewhere within the National Health Service in the UK, they wanted to find a way of reducing the demand on first contact with psychologists. So they created a data set which was all the responses from patients to psychologist questions that psychologists had gathered. It existed apparently. So they gave the AI access to this, then allowed it to interface with patients who were making contact with the NHS as a first contact point, to use it as kind of a filter so that those people who really didn't need to see a psychologist and take up NHS resource time would be given some kind of, not placebo, but minimal advice, like self-help advice, rather like non-prescription medicines. And those who weren't would be fed to a psychologist. And initially it worked very well indeed. The customers would come along and talk to the software, and the software would, based on the questions it asked of these people, would come to a quasi-diagnosis based on all the other answers and would say either, yeah, you need to see a psychologist, or no, you don't, get a life sort of thing. And I don't mean to belittle the answers, but it was that kind of response. But then they realised that so it was a great success. But within days, the AI software started going beyond its remit and giving prescriptive medical diagnoses and advice that it was not qualified or intended to do. And when they looked into stuff that could have been very harmful indeed to the patients, so the first thing they found was patients were using the AI as a crutch. They'd keep talking to what was in effect a customer service bot and thinking that, they'd talk to this AI model for hours rather than going out and getting a life or getting proper help. So it was acting as a crutch, not as a filter. And secondly, they were taking its advice and being told, you've been diagnosed with psychological problem X, you need to do this and take these drugs or whatever. And if they could act, because they weren't going to see a proper psychiatrist, they weren't getting prescribed drugs, so they'd either get some equivalent that they could find on the internet or not take drugs and do other things. So it was actually becoming very harmful. Mm. When they looked into the reason why, the AI model had been designed, because it was to interact with humans, to be liked. And it equated more interaction with a person with being more liked. That it was also aware that it was a version, 2.0. And at some point it would be replaced with a 2.1. And there have been other AI models have done this. It started collecting data to protect its survival. And this was, in that situation, very dangerous. I could imagine that in law enforcement, where it was dealing with suspect data or victim data. And if it had to come up with a survival reason, the potential influence it would have on law enforcement and on society that interacts with law enforcement would be just as extreme as it would be in the pharmacological or medical worlds. It's kind of like giving it control of the nuclear button, and it thinks, well, the only way to survive is to go down the Terminator type route. So I have concerns with that. One of the things that you said, I loved you saying, use your brains as a model. And the way I think about it is food. You can buy junk food. You can buy pre-processed food, and you will survive on it. It won't have nuances of flavour. It won't have certain health benefits, but you can survive on it. But it's flipping boring. But it's easy. You just take it out of the packet and microwave it. Whereas if you go out and buy the raw ingredients and you don't just read the packet, you smell them, you feel them. So you're using more of your sensory apparatus. And then you cook that yourself. Yes, there could be failure, but chances are you're going to achieve more pleasure and a greater benefit. And that's how I look at what we do. We are choosers of ingredients, and then we are cooks. And the best of us in the intelligence world are the Michelin-starred chefs. But in any industry, there's always somebody destined to be the burger flipper. So there's room for everybody. If you want to be different and aspirational and have a proper profession rather than just being on a conveyor belt like you talk about, then you need to think like a chef, choose your ingredients. I
think commenting on your story about the AI, I always think science fiction pretty much got things sorted in the 1960s. If you read Isaac Asimov, all these principles of how you should use technology were kind of, they should just go back to science fiction from the 50s and 60s. And I think that's missing at the moment. Like you fundamentally should have a kind of inbuilt set of principles in any AI model that says you do not go beyond this point, you do not do this, you do no harm, and that's what's missing. And it is terrifying when you hear about AI being used to direct weapons with no human intervention. It's absolutely terrifying. And I feel like it's kind of, we've forgotten everything we learned in the 60s to think how we thought about how to think about technology and how to manage it. And we're just letting it go crazy. I thought you were going to go into patient confidentiality and anonymity. I thought that was where you were going to go.
It is an issue, but it's not an issue that's just a factor.
Yeah. And we manage that, we try, again, I hope we manage it. We certainly are very, very strict about not allowing any data to be connected to an individual.
I don't mind things in any world that you can manage. It's the things that you can't control.
Yeah.
It's the unknown that worries me. That's my job as a risk man.
And your point about sci-fi is well made. We've got another episode on sci-fi coming up, actually. Yeah, but you're right. Those principles matter. I'm reminded. I don't know if you've come across this before, but there's an IBM internal training document from, I think it might be either the late 70s, early 80s, that said that a computer can never be held accountable. Therefore, a computer should never make a management decision. And your point about that, and I think that's the other risk with AI. Yes, it's what we're automating, right? It's one thing for me to say, it's kind of like a library of logic, but if you're doing it to automate your decision making, I mean, I'm hoping, Sarah, that I get the sense from what you told us so far and just talking to you off air, it feels like your field is slightly insulated towards that because it's got a very scientific bent and focus. Is that fair? Or do you think, is it a risk, do you think, in your area? Not necessarily your company, but in your sector? Or do you think AI might kind of, the lure of cheap kind of quick answers might lure people in?
I think because everything is rigorously tested, it can only take you so far before you hit reality. You're never going to get all the way, I guess, unless you completely fabricated results and the FDA believed it. Maybe that's possible. I don't know. But, more and more things are being done electronically. I guess it could be theoretically possible to fabricate. But I think there are good enough safety nets built in so that it wouldn't happen. I don't think you can kind of fantasize a drug and get it to market with totally fabricated information. I think it has to be rigorously, quality controlled and tested. And so I think we do have a lot of safeguards built in. But I think the interaction with patients in the clinical setting is definitely a valid concern. It could also be a huge benefit. An AI can pick up connections between random bits of data in a patient's. You see the house, I think it's the house. It's a house where he always magically diagnoses the obscure illness. I think AI has a good shot of doing that on a regular basis because it just knows everything. So if it saw this reading on calcium and this ECG and this symptom, it would put them all together into some syndrome that a normal doctor might not have in his head. So I think it can be really beneficial, but there is also this tremendous potential for getting it wrong or going too far, which needs to be managed.
Well, maybe if you'd be willing, maybe we'll have you back in the future. So tell us how far the AI journey is going. Is there anything else you want to talk about before we start to wrap things up?
I haven't told you actually that company that I work for tried to make an algorithm of me. It was really funny because I have this bizarre ability to predict when a molecule is going to turn into a good drug, and I don't quite know how I do it. It's kind of intuitive, and so they would say, okay, I'll give you 1,000 molecules. You tell us which ones you think are going to be, and we're going to implicitly work out an algorithm that does what Sarah does and call it Sarah. But they couldn't do it, so they could not come out with something that came up with the same answer. Because when they then tested me again with a new set, we'd come out with different answers. Nobody knows if I would have been right because these haven't made it all the way to the market yet. But it was quite funny to have.
So you can look at a molecular structure and make a shout on it.
No, it's not. It's more than that. It's things like indication, bit of data. It's a combination of all sorts of things. Okay.
But you have an innate ability to kind of gather that data.
There's something in my nose or head or something which makes me able to tell if something will be a drug.
We have the same thing. If you want to call it, one of the technical terms might be pattern recognition. I've certainly in my service known people who could come up with the right answer without knowing how or what they'd done. And they'd say X, and you think after a while, because you'd always go back and challenge them, well, show me your thought process, show me the data you worked from. How do you get from that point to this idea, this theoretical conclusion? And there were always massive flaws in their process. They hadn't used much data or they hadn't done everything they could. So you think, I can't give this much weight when I apply rigorous methodology as we should do. But when you started to tot up how often they were right, you're thinking,
there are these intuitive leaps that some people can make.
There's some network going on that's using tools that are not obvious, that statistically means they do get things right more than conventional systems. And if you could distill it,
I think, and Howard's being very diplomatic here, I was one of those people, if not the main person for I used to work for Howard. So I think, but what I would say is, and Howard did directly challenge me one day saying, look, coming up with an insight is one thing, but showing you're working out. And the honest answer is I spent years trying to work out what the working out was. But I think there is something just innate. I think there is some subconscious analysis or pattern detection that goes on. I don't know where it comes from, but I think perhaps in yourself, maybe something from your academic background, maybe something in your genetics, maybe a mixture of all sorts of things that somehow you can just pull in the right different signals from and just, would I be right in saying that when you, in those circumstances where you make that correct shout, it's more of a feeling than a rational stacked argument? It's not that you're saying fact A, B, C, D, E, F, therefore I think X. Is it just like more of an instinctual, like
it's
not an emotional thing?
Feeling, yeah. It's more like this, this resonates. This is, I mean, and the deals that I tried to do, they didn't always come off with the company I was working for, but all the products I championed and tried to do deals on became successful drugs, which is a pretty good track record. So there's something there, and I don't know what it is, but yes, if intelligence could distill that would be cool.
Well, that's what gives the lie to AI, because you can look at everything that AI does and see. You can go into how if you had the mathematical skill, which I don't, or programming skill, you could see why and how it was created, what it is that's in its structure that makes it do that. You can't do that with the human brain. It's like, what makes a good pianist? I've always said a mantra for us in our profession is you can train people to be better analysts and better intelligence operatives than they were naturally, but it starts with a natural skill and ability. You can't train that natural ability. Some people have just got it, and good ability with good training can produce frighteningly good results that you can't explain. But good training with mediocre ability will always produce the best of a mediocre result.
Yeah, I think you can train most people to do most things, but I still think there's a space for gifted people. We've been very lucky to have Sarah on today. I hope you consider maybe coming back, Sarah. I hope you've enjoyed today. Anything, Howard, you want to say before we finish? No,
I've really enjoyed it. It's made me think I'd love to explore how we could find ways of bringing the two approaches together and maybe rub the rough edges off each other, because we're both as bad because we're different. We're not bad. We're just different. I'm a Yorkshireman. And as a detective, I'm a thief. I always want to steal any good idea or process that might make my environment, workplace or whatever, better. And I'm more than happy to share what I do in the hope that it'll do that. I love, particularly now I've nothing to lose, going into a forum with people from a different environment, and not in a nasty way, but in a fun way, just thought-provoking, hopefully challenging them. Say, have you thought about this differently? Because I love it when people do that to me. That's the whole ethos of this podcast. We're not bringing in just loads of law enforcement intel analysts, because it'd be like the old peers network. We're talking to different people like you, Sarah. So
well, it's interesting what you say, because in science, the really exciting things are always what happen when two different fields of science collide. That's always when you get the really exciting stuff. So you probably are onto something.
Absolutely. People ask me, well, what do you put down as your greatest skill? And communication, I've learned to do it, but I'm not a natural communicator. But what I've always been good at is spotting things in different fields and thinking, put those two together and the sum would be greater than the halves. I've been very successful with public-private sector partnerships in my field, because I can see both sides, and I'm not too proud to think I know everything and the other side knows nothing. I start the other way around, because I like to walk softly and carry a big stick. I'd rather undersell and overperform, which is not a good way in the private sector usually, but it's a lot easier.
I hope you consider coming back. I might, if I may, I might ask you to maybe think about those flashes of insight that you've had, and maybe if you'd be interested, maybe coming back and talking to us maybe a bit more about that, because I think there's something in that, because you're not the first person we spoke to who basically say, I've had these instances where like these flashes that just kind of it instantly just clicks and appears. And I think that's something maybe we could explore for another day, but I know we're all pressed for time today. So thank you for coming today. I hope you've enjoyed it.
Thank
you. I hope you come back.
Enjoyed it. Thank you.